Okay, welcome back. And once again, I want to thank everyone for taking time today, regardless of where you're located, to listen in. My name is David Kunashko. I'm the Director of Education and Research here at Meditech International, based out of Toronto, Ontario, Canada, where we specialize in photobiomodulation, or sometimes referred to as cold laser therapy or low-level laser therapy, or lots of other terms. So a bit of housekeeping before we actually get going here. All my webinars are actually recorded, they're edited, and then if you happen not to be able to tune in or leave early, or you want to listen again, we send out a follow-up email, usually about a week or so after the initial broadcast, and that will have a link to watch the webinar again. Otherwise, they are posted for review at any time on our BioFlex laser therapy website, but it's a support page support page that you have to access, and you would have to have our equipment in order to get a password and username for that. So the last webinar of the year is a review of some of the interesting research that I've come across in 2020. Of course, we all know the times that we live in and the pandemic that we live in. Actually, I was reading today that they figure that the mass vaccination in Canada, anyhow, will be completed by September, and they're forecasting in the United States to be done even sooner. So hang in there, everyone, and it looks like we'll be getting closer to normal times soon. Every year, there's hundreds of papers that are published on photobiomodulation, and the theme that I noticed this year wasn't COVID, although there was research on that, was dental applications. The dental world really has a keen interest in photobiomodulation for different reasons, for pain, for bone healing, lots of different areas. Now, actually, I didn't even mention a dental research paper in today's webinar, but I did find that interesting that the dentists are definitely getting into this type of therapy. Okay, well, let's get started. Obviously, you know, one of the things that we're trying to do here is get through this year and combat and get rid of COVID. So I'm going to actually start off with that topic. But now, before I actually get going on that, I want to just take a second or a few minutes here just to review these important issues about inflammation, because I will talk about these cytokines during today's webinar. So I want everyone to understand. Now, when you're talking about cytokines, these are chemicals released by white blood cells that control inflammation. And I'm sure you've heard about the cytokine storm that COVID produces. But of course, all the conditions that we treat on a daily basis, we're dealing with inflammation. So now when white blood cells release pro-inflammatory cytokines, that of course increases inflammation and causes lots of problems. These include, but aren't limited to, bradykinins, interleukin-1, 6, 8, interferon gamma, nitric oxide outside the cell, platelet activating factors, tumor necrosis factor. So when you see these go up, it's bad. Now, to combat that, the body will trigger anti-inflammatory cytokines when it starts to resolve inflammation. And of course, there's drugs and other techniques to do this. Well, of course, photobiomodulation can also increase anti-inflammatory cytokines, including interleukin-4, 10, 13, and transforming growth factor beta. So knowing that is important as we move forward in today's webinar. So back in my research days at University of Toronto, I remember using an electron microscope and was completely fascinated by it. My background actually is in molecular biology and virology, although it was plant viruses. So I found it interesting when I was looking at some of the research and the pictures. Here's a EM electron micrograph picture of COVID virus that's being secreted by epithelial cells. The airway epithelial cells. If we look a bit closer, you can see, you know, it's been enhanced, but you can see all the virions being secreted by infected epithelial cells that have cilia, of course, right? So that's what it looks like. You can see, 100 nanometers is quite small. So that's the pathogen that we're dealing with. Now, when I do searches for research, what I do is I search PBMT, and I put or, has to be capitalized, then LLLT, and then and capitalized, and in this case, COVID. So when you go to PubMed, that's how you're going to do a search. And in this case, it pulled up 11 papers. So 11 papers were done in this year and published, believe it or not, in a very quick time frame on photobiomodulation and COVID. The one that I'm going to really talk about was a systematic review. When you think about it, a systematic review is only really done when there's enough research to review all the research, and it has the most insight. So this particular one was on the probable positive effects of PBM as an adjunctive treatment in COVID. So we all know, I'm not going to bore everyone with respect to the hallmark of COVID, pneumonia, dyspnea, acute respiratory distress, the cytokine release. We all know that, we've read about that. The issue is, can the anti-inflammatory effect of photobiomodulation be helpful? And we of course know there's hundreds and hundreds, if not thousands, of papers that talk about the anti-inflammatory effect of photobiomodulation. And this particular systematic review took a look at those 17 papers, and all of them were in animal models. So again, this isn't humans, although there was a case study or a couple on humans, but that was just a single case study. So these papers showed that photobiomodulation could significantly decrease pulmonary edema, neutrophil influx, and the generation of those pro-inflammatory cytokines I mentioned earlier. So it actually has shown to do that. Now, when you look at the effects of COVID on the left here, you can see that it attacks different cell types, but especially alveolar epithelial cells. That's the picture I showed you earlier. And it will activate macrophages and neutrophils. They go to the area, they increase all those nasty cytokines to a huge degree. And at the same time, the pro-inflammatory cytokine interleukin 10 is decreased. This can, as we know, cause multi-organ failure and acute respiratory distress syndrome. So photobiomodulation, now if you look, it's really interesting, the wavelengths, 650 to 830. So in and around the red and the near infrared are the wavelengths traditionally used in photobiomodulation, and it appears that photobiomodulation can reverse the cytokine storm in animal models, or at least help reduce the inflammatory cytokines and increase the decrease the pro-inflammatory cytokines and increase the anti-inflammatory cytokine interleukin 10 to help reduce inflammation, improve oxygenation and tissue, regeneration. So the conclusion in the systematic review was that photobiomodulation could be helpful in reducing lung inflammation and promoting the regeneration of damaged tissue. It can increase oxygenation indirectly in order to rehabilitate affected organs. And so at this point, they're saying that infrared and maybe red, but especially infrared, whether it's lasers or LEDs, may in fact be helpful. Next paper I wanted to talk about was this particular one on spinal cord injuries. I thought it was really interesting. It looked at sensory and motor responses after photobiomodulation, along with physiotherapy in patients that had incomplete spinal cord injuries, and it was a clinical randomized trial. So for the most part, we're interested in human randomized control trials. It gives us a little bit more weight, whether or not it's effective. This particular study looked at the effects of photobiomodulation along with physiotherapy, and especially in the quality of life in individuals with spinal cord injury. They looked at 30 participants, either PBM group or a sham group. They also had physio 3 times a week. And they were looking at the sensitivity and motor skills being evaluated by the Asia impairment scale, as well as quality of life using a questionnaire as well. This is really how they did it. If you look, you can see the incision where there was surgery. In this case, it's obviously the lower back. No, you know what? I don't know what that case is. It could have actually looked like the thoracic region, but or the lower back. Anyway, whatever. What's interesting is that the wavelength they used, 808 nanometers, so near infrared, that's the one that's going to penetrate deeper. Continuous wave as opposed to any form of modulation or frequency. 120 milliwatts. So again, it's important to understand the power. They did 5 points only, which is interesting. And they did a contact technique, which I've talked about a lot. That's where the probe or the laser diode actually touches the skin. That's really important if you want light to go into the body. If it's held away from the skin, you're going to lose up to 85% of light. So why would you do that? And the frequency of treatment, 3 times per week for 4 weeks in total. By the way, as I'm talking, feel free to ask me questions. I'll get to those questions at the very end of the webinar. So I'm not going to actually go to those questions right now, but feel free to ask those questions as we go along. So this particular randomized control trial concluded that there were improvements in sensitivity and an increase in the perception of muscle contraction found in the active photobiomodulation group 30 days after treatment compared with the sham group. They also found that the questionnaire reveals significant difference in general quality of life, favoring the active photobiomodulation group over the sham group after treatment. So therefore, physiotherapy combined with photobiomodulation leads to better sensory motor recovery in patients with partial, in this case, partial spinal cord injury, as well as better perception of health and quality of life. And of course, we all know that there's always a placebo effect, but it was much more stronger and statistically significant in the PBM group. Next paper I thought was interesting was the effect of notice that the research is referring to photobiomodulation now, not so much laser therapy, on the repair of pressure ulcers in adult and elderly patients. Again, a powerful paper because it was a systematic review. Many of you may not be treating pressure ulcers, depending on your scope of practice or what you do as a clinician, but pressure ulcers are defined as an area of damaged skin and or tissue deep into the skin, usually over bony eminences or prominences while the patient is bed bound, and it results in prolonged intense pressure. The prevalence rate is actually very high, upwards of 24%, and incident rates of, again, up to 26% in different care settings. So these are very common in the elderly, obviously. So it's problematic because it can become infected and cause lots of issues. The average cost, this is in the United States, was $26.8 billion per year in ulcers with patients just in the hospital setting. Just so you're aware, pressure sores or ulcers are graded, 1 being very at the beginning stages and then progressing to 2, 3, and then a big open ulcer lesion at stage 4. So most of the work done with photobiomodulation typically uses power densities of 100 milliwatts per centimeter squared and energy densities between 4 and 10 joules per centimeter squared. If you're not familiar with this terminology, I have talked about this in the past, and certainly you're welcome to take one of our certification trainings so you can have a little bit better understanding of these types of dosage terminologies. The mechanisms of laser, of course, we talked about it earlier, about the reduction of pro-inflammatory cytokines, reduction of something called MMPs, which is matrix metalloproteinases, which is an enzyme that degrades collagen. And by reducing MMPs, you can aid in the formation of better and more organized tissue. And it promotes neovascularization, which is also important for an angiogenic or blood forming effect. So in this particular systematic review, they looked at the treatment of pressure ulcers in a total of 207 adults and elderly participants. And they concluded that using laser therapy showed efficacy in the healing of pressure ulcers similar to other technologies, And you may say, well, what's the big advantage? Well, the advantage is laser is cheap. It's very safe to use in a hospital setting or on patients. Even family members can do it. There's really few contraindications. So actually has advantages over typical technologies used for healing ulcers. They found that the red wavelength was very effective, around 660 nanometers. If you are familiar with these wavelengths, you know that red is very good for skin, and specifically in the stage 2 and 3 pressure ulcers that I showed you earlier. Next paper was on multiple sclerosis. We have treated patients with MS. Occasionally I get questions about MS. This was a randomized clinical trial specifically looking at interleukin 10. Okay, interleukin 10. Do you remember what that one was? That was an anti-inflammatory interleukin. It's a good one. So you want more of interleukin 10 when you have multiple sclerosis, and nitrites as well. So the objective here was to measure the expression of these of this interleukin as well as nitrites in individuals with relapsing, remitting multiple sclerosis, because they know these biomarkers have or play a fundamental role in the pathophysiology of the disease. So the modulation of interleukin 10 and nitrates through treatment of PBM may be a novel treatment for multiple sclerosis. This was a randomized, uncontrolled clinical trial looking just at 14 individuals. So obviously it's not a powerful paper, but certainly it gives us good information or insight. And they were looking at scoring it using an expanded disability status scale. Just a review, multiple sclerosis. They're not sure of the exact etiology. They of course think it's autoimmune. Essentially what happens is the white blood cells attack the neurons, and this will cause scar tissue. It will affect the fatty tissues, the myelin. It starts to degrade both in the nerve fibers in the brain and the spinal cord, and the nerve signals are slowed or blocked, and then the patients start to have symptoms. So that's really the pathophysiology of what's going on. So strategies obviously for increasing interleukin 10 may be effective with people with MS. So evidence suggests, of course, we know that photobiomodulation is absorbed by certain chromophores. This can lead to increased cellular respiration, increased ATP production, and a positive modulation of interleukin 10 and oxidative or nitrosative stress. So essentially, PBM may be a promising strategy to complement the treatment of multiple sclerosis. Not a lot of work on this research-wise, but you know, if you have patients that have MS, I would definitely use it. I think it can be of great benefit, not to stop the condition, obviously, but to help to control, especially in mild to moderate symptoms or early on. I think it would have a great benefit, but even during severe courses as well. So in this particular case, they treated sublingually, which is you know, in the mouth. They were trying to treat the blood as well as over the radial artery. So they just used the device directly in the mouth, in the sublingual region, and they irradiated over the radial artery as well. If you're familiar with BioFlex equipment, you know that a big part of our treatment is treating blood with our large surface array. We feel it's really effective to treat a large volume of blood. Although we haven't done this type of measurement study before, but I would think that our equipment would be as if not more effective than just using treatment specifically on one area. Wavelength, again, infrared, power 100 milliwatts, and you can see the different dosaging. Treatment time was 360 seconds at 6 minutes, a total of 36 joules. Twice a week treatment for 12 weeks. Again, you're gonna have to treat these patients for long periods of time, you know, at least 2 or 3 times a week. The results were that after treatment with photobiomodulation, the expression of interleukin 10 was increased significantly in both the sublingual group and the radial artery group. They did, however, find in contrast the nitrite levels didn't diminish significantly, so they didn't really found any effect on the nitrite levels. We know that interleukin-10 inhibits the expression of pro-inflammatory cytokines and neutralizes or reduces the inflammatory process. So it makes sense that it would be helpful in quelling or decreasing inflammation of the nerves in the central nervous system in patients that have MS. So obviously strategies to increase interleukin-10 may be helpful in treating these types of autoimmune diseases like MS. Of course, we have success in treating RA as well, so for a similar strategy. My next paper was on low-level laser therapy for treating pain post-cesarean section. Again, a randomized control trial. They looked at 88 women postpartum. They were divided into 4 different groups: control, placebo, experimental using 4 joules, and experimental using 2 joules of energy. They looked at using a numeric rating scale, or like a visual analog scale, algometry, a global change perception scale, and these were assessed at 12 hours, 20 to 24 hours, and up to 48 hours postpartum. They only did 2 sessions, and they were performed at 12 hours and 24 hours postpartum. This is essentially what they did. You can see the incision, and you can see the points where they used the laser. It was a gallium aluminum arsenide, 660 nanometer red, 30 milliwatt power. You can see the differences between experimental 1 and 2, same wavelength, same power, but half the amount of energy density, so 2 joules instead of 4 joules per centimeter squared. So remember that when you talk about pain relief with laser therapy, it can be mediated in different ways, including the reduction of prostaglandins that causes pain, as well as other compounds that control inflammation. Analgesia can also be helped with the release of endogenous endorphins and enkephalins, and something called hyperpolarization of nerve endings. This inhibits the transmission of painful stimuli. I always recommend using high intensity red laser to help with pain. We typically use the infrared laser probe that comes standard with our equipment, but I always recommend, if you're able to, also add a red laser probe, because we know that it is very powerful in helping with pain. And these are the results. So if you look at the control and placebo, first evaluation, second evaluation, third evaluation over a period of time, you can see the visual analog scale, the pain in the control and the placebo initially went up, and then you got a slight improvement. Well, of course, there is time and a placebo effect. But now if you look at the experimental group 1 and 2, you can see clearly that after the first evaluation to the second evaluation, there was less pain compared to the placebo control. And then at the final evaluation at about 48 hours, you can actually see that there was significantly more pain reduction compared to the control and placebo. So what does that say? Well, that says that if you use a red laser probe, you can achieve some better pain relief than just using nothing, or in fact, of course, it's much safer than taking medications. And of course, a pregnant, a postpartum woman, you probably don't want, probably doesn't want to be taking lots of drugs, that kind of stuff for pain. So it's a valuable option. The next paper was on the acute effects of photobiomodulation therapy. By the way, I'm thinking that I'll probably go closer to 1 o'clock today, although we'll see how that goes. And this particular one looked at photobiomodulation applied to the respiratory muscles of chronic obstructive pulmonary disease, or COPD. And it was a double-blinded, randomized, placebo-controlled crossover study. So it was actually a pretty powerful study, although they only used 12 male patients. They were randomly allocated to receive just 2 photobiomodulation sessions 1 week apart. And so they were looking at an effective photobiomodulation session applied to the respiratory muscles with a cluster of LEDs. 35 were red, 630 nanometers, 10 milliwatts total power, and 34 near infrared, 830 nanometers, 10 milliwatts. And they also did a sham photobiomodulation as well. So the primary outcomes, they were looking at pulmonary function, they were looking at thoraco-abdominal mobility, respiratory muscle strength at both baseline, 1 hour after the intervention, and 24 hours after the intervention. And what was really interesting is they looked at the functional capacity. That is how long a COPD patient could walk in 6 minutes. It's called the 6MWT test at both baseline and 24 hours after intervention. So that very interesting, right? So this is where they applied those LEDs. And if you're familiar with BioFlex, you would know that we have very large sort of surface arrays of infrared and red that could do similar types of treatment. So the results, PBMT was not effective in improving lung function, respiratory muscle strength, and thoraco-abdominal mobility. You might say, well, what's the point there? Well, first of all, let's understand that they only did 2 treatments. So if you're expecting a lot of improving functioning of muscle, lung function, and mobility after 2 sessions, that's not probably realistic. But what was very fascinating was that there was a significant improvement in the functional capacity as measured by that 6MWT test. So on average, there was an increase of 73 meters that they could cover or walk in those 6 minutes. So just so you know, greater than 70 meters is required to be 95% confident that there's a significant change has occurred in their 6MWT. In other words, by being able to walk more than 70 meters after treatment indicates that in fact it was an effective way of increasing their function. And an increase of just 26 meters could be considered clinically relevant improvement. Overall, you can see that in just using a couple of sessions, you could improve the functioning, the ability to breathe, which of course improves the ability to walk. And I believe that if you were to treat on a consistent basis, you would see improvement in lung function, respiratory muscle strength, and thoraco-abdominal mobility over a period of time. Next paper, I always get asked this question, and just because there's stuff on the market about using laser therapy for weight reduction. And to be honest, I wasn't going to discuss this paper because I'm not a fan of the science, but because I get asked about it so much, I wanted to discuss it and talk a bit about it. But you can probably sense that I'm a little hesitant with respect to its efficacy or the actual weight of the science. Anyway, this paper looked at 60 overweight individuals, BMI, you can see measured here. They were randomized. They had 12 sessions of laser therapy, 2 times a week for 4 weeks, twice weekly, once weekly, up to 12 weeks. They all attended in-person visit baseline at weeks 4, 6, and 12. So there has been some research in this field. There's different theories what light can do to lipocytes. One of the theories is that it produces transient pores where lipids can flow out and initiate lipid peroxidation, which temporarily damages the cellular membrane of adipocytes by creating pores. I've seen the research. I'm not convinced that that's what's going on, and it hasn't been reproduced very well. So I'm a little on the fence on that one. So anyway, moving on, this particular paper, these patients also had behavioral interventions, a Mayo Clinic My Weight Solution Manual, of course, topics of how to lose weight and so on and so forth. And this is the light that they used, which perplexes me, but it's 17 milliwatts of green wavelength, 532 nanometers. Now, if you're familiar with the wavelengths, you'll know that green light is highly absorbed by hemoglobin and penetrates maybe a millimeter or 2, if that, in the human body. So I'm really stretching to understand how green light would do anything in lipocytes, but I will go on. So this is what they found. They actually found that there were reductions in waist circumference and body mass index and body fat mass. So they found that when they're treating twice weekly for 6 weeks, they felt that that was the optimal frequency to help these patients lose weight. Remember that these patients were also perhaps undergoing other behavioral modifications or changes. So in my book, I'm not convinced that laser therapy does anything directly to help with weight loss. But I'm on the fence. I mean, if you show me some better science and maybe use wavelengths that can go deep to the skin, I would be interested in learning a bit more about it. So yeah, just a little bit on the fence on that one. Okay, next was the effect of a single irradiation low-level laser on nipple pain in breastfeeding women, and it was a randomized control trial. I found this one to be super interesting, and I'll explain why. So basically, the women were randomly assigned. There's 40 into the laser group, 40 into the control group. The intervention was 660 nanometers, 100 milliwatts. Notice the amount of joules, 2 joules of energy. And Lauren Brown, Dr. Lauren Brown, if you're listening in Vancouver, who is intensely interested in the use of photobiomodulation, especially for fertility reasons. He's a doc of TCM. He and I talk a lot about dosaging and different parameters. So 2 joules is not very much, right, Lauren? So they did a punctual, which is touching the skin, 20 seconds of irradiation applied directly. Then they looked at pain levels before and immediately after irradiation, 6 and 24 hours after treatment, and the pain level was assessed using a VAS. So it was a one single irradiation contact mode perpendicular to the area of the nipple that was most affected. 2 joules of energy, again, 2 joules, not much. Laser protocol apparently was not effective in reducing pain in women with damaged nipples. And they also reported, interestingly enough, a tingling sensation may be experienced by women receiving laser treatment for nipple damage. If you've had intense red laser on your skin, you may in fact feel that sensation, especially in areas that are highly innervated. So that's not uncommon. It's not a major thing, but be aware of that. So the question is, why, Dr. Lauren Brown, was this not effective? Well, let's take a look at the research, shall we? This paper published in part by Chukuka and Wemeka and some of his colleagues. Now, Chukuka is a world-renowned, long historical researcher in laser therapy. This paper was published very recently on the optimal parameters that you would use laser therapy to help for pain. It was a systematic meta-analysis. They looked at 96 papers, right? They looked at all the different parameters, all the different energy densities, and guess what? They found that for optimal pain relief, you'll be wanting to do anywhere from 120 to 162 joules of energy for red and 15 to 20 joules for near infrared. So what does that say? That says that if you're going to do research using photobiomodulation, again, it's one of my pet peeves is that when you see negative studies, they're negative for a reason. And the reason typically is the researchers didn't choose appropriate dosaging or parameters in order to prove a hypothesis, right? So you need to understand that if you're looking to block pain, energy, especially energy densities, need to be extremely high in order to block pain. Okay, this next paper, very fascinating, and I want to mention a particular researcher, Professor Emeritus Michael Hamlin. Michael Hamlin is I don't know if he's active in research as far as papers. I don't know if he's still on the lab, but Michael Hamlin is probably the world expert in photobiomodulation and neurological conditions with respect to things like neurodegenerative conditions, post-concussion, stroke, all those different types of things. So they did a systematic review of photobiomodulation, in this case for Parkinson's. Now note, this was in animal models. Okay, so just bear that in mind. So photobiomodulation may be an effective treatment for Parkinson's. Now, it can use red or near infrared. It can be from a laser and LED, and it's typically at relatively lower power densities, but specifically, it may be on the head or, I repeat, or other body parts to stimulate the brain and prevent degeneration of neurons. So as we all know, PD is a progressive neurodegenerative disorder. The problem lies very deep in the brain in the substantia nigra and involves loss of dopamine producing neurons. It's a movement disorder, as we're very aware of. Treatment really for the most part is either dopamine replacement therapy, which doesn't affect the progression, only that helps the symptoms, and something called electrical deep brain stimulation, where they drill a hole in your skull and put an electrode and stimulate into the substantia nigra, which has shown very positive effects, but of course is very invasive. So since the brain has a lot of mitochondrial activity, as you probably know, neurons have the most number of mitochondria per cell, other than sperm, in the human body. So it's not surprising that photobiomodulation, which has a profound effect on mitochondrial activity, may in fact be very helpful, which is why they're doing a lot of testing. Photobiomodulation leads to the upregulation of antioxidant defenses, anti-apoptosis or anti-death, and pro-survival signaling. These are all activated. Stem cells, they're mobilized and they can migrate towards the sites of injury where they can repair the damage. This is super important because if you treat anywhere where there's bone marrow, especially near the brain, i.e. on the cranium, then you actually mobilize stem cells and they can go into the blood and they find the areas of inflammation and they can be very helpful. Just like they do stem cell injections, right? But this is a natural way of doing it. Also, the mitochondrial alteration can switch macrophage and microglial phenotypes from pro-inflammatory state to the anti-inflammatory state. So from M1 to M2. In the brain, there's neurotrophic factors. Neurotrophic factors are factors that affect the ability of neurons to grow or to repair themselves. And these are stimulated through neurogenesis and synaptogenesis and neuroplasticity. These are all encouraged or increased due to photobiomodulation. So this is Michael Hanlon speaking in the paper. He says, one question that is often asked about photobiomodulation for the brain is how important is it to apply the light to the head and for the photons to actually penetrate the brain tissue? And also, how important is it for the light to be absorbed by circulating blood or bone marrow? So this latter pathway, that is blood treatment and bone marrow treatment, these latter pathways might explain the systemic or abscopal effects of photobiomodulation, which have been reported now by many authors. There's been a recent discovery of respiratory competent cell-free mitochondria that are circulating in the blood of normal individuals. And it appears that when you put light on different areas of the body away from the brain, that in fact it can affect the brain. Let me explain. So essentially, when you're dealing with light that can penetrate into the brain itself, it's limited. He comments here that light going into deeper brain structures, such as the substantia nigra, is pretty much impossible. And so he says not particularly encouraging. In other words, you're not going to have a direct effect of light on the substantia nigra. So then how is light helping? Well, they're actually doing some research now into the application of light to the abdomen as well as transcranially or around the skull, around the neck. This is to affect the gut microbiome. This is referred to as photobiomics, may also be important here. So the evidence is suggesting in the systematic review that photobiomodulation, especially transcranially at this point, can be effective in treating animal models that have Parkinson's. I won't go into the details, but there's a really good animal model that replicates Parkinson's disease. So the other interesting thing is that Hamlin has been one of the researchers to find that pulsing of the light at specific or certain frequencies may be more effective than just a continuous wave of light for these types of conditions. These pulsing frequencies seem to be close to the alpha and gamma rhythms, which is 10 hertz and 40 hertz. So these repetition regimes have been used for treating animal models anywhere from a few times per day to every few days for as long as 4 weeks. So we know that you need to treat these patients fairly consistently. It's a chronic degenerative disease. So obviously expected that you need to do ongoing treatment. So there have been encouraging results in these animal studies, obviously. So this has led now to some photobiomodulation studies on actual patients. This particular paper by Hamilton and his colleagues, they were using basically like a light helmet using LEDs, the wavelengths red, near infrared, treating patients with PD. They did 1,800 joules of total energy for 30 days. The initial symptoms of tremor, akinesia, gait, difficulty in swallowing speech, poor facial animation, reduced fine motor skills, loss of sense of smell, impaired social confidence, they were all improved in approximately 75% of the subjects. And while the other 25% remained the same but didn't get any worse. So the improvements were still maintained over an extended period of time. That's critical because that means that you're making some permanent changes in these neurons. So there are additional clinical trials in progress right now by applying light to the head and even to the abdomen with the goal of improving the gut microbiome. And of course, we're all anxiously awaiting the results of these trials. Okay, another paper, boy, I'm running out of time. I think this is my last, I'm not sure, is the safety and efficacy of photobiomodulation therapy in oncology, a systematic review. They were looking at in vitro and in vivo and clinical studies looking to see what kind of effect photobiomodulation has on cell proliferation, differentiation, tumor growth, recurrence rate, and overall survival rate. In vitro studies investigated the effect of PBMT on a diverse range of cancer cell lines, but interesting, the results were conflicting. And it could be due to the differences used in parameters or the frequency, how often it was treated, those cells were treated, and so forth. Different in vivo. In vivo and clinical trials with a follow-up period demonstrated that PBMT is safe with regards to tumor growth and patient advantage in the prevention and treatment of specific cancer therapy related complications, like oral mucositis, for example. So current human studies supported by most animal studies show safety with photobiomodulation using currently recommended clinical parameters, including head and neck cancer in patients that have been exposed to PBMT. There is a significant and growing literature that's indicating PBMT is safe and effective and may even offer a benefit in patient overall survival. Nevertheless, and I repeat, nevertheless, continuing research is indicated to improve the understanding and provide further elucidation of remaining questions regarding PBM use in oncology. So my goal here is to let you guys know where things are at, not to be advocating at this point yet, because we just don't know.